Hello everyone, my name is Nabila Syahrani Selima and I'm a student. So, in this video, we're gonna go through a summary sticking with the fact about what you need to know about COVID-19, all called by coronavirus. Coronavirus is a viruses that have little spikes on the surface that look like a crown, which is how it got its name. You have probably heard about the other type of coronavirus. There was a SARS coronavirus, which happened in 2002, and there was a MERS coronavirus, which happened in 2012. There are a lot types of coronavirus, and they don't get a name because just cause common cold. The virus we've been dealing with is SARS-CoV-2, and the disease is coronavirus 2019 and COVID-19 for short. Bats are actually a naturally reservoir of many viruses. So the virus can actually replicating inside the bat without making it sick, and then the bat passes it on to the other animals, and finally that get passed on the human. And that's what happened in Wuhan. After the first person was infected, the virus spreading from the person to person to person by people coughing or sneezing. Did you know that in just one cough, it can spread 3,000 droplets that it can spread anywhere all over the world? If you get smacked in the face by someone cough, you get direct transmission of the virus. So, let's say you get in touch with this virus and then you rub your face and then you get infected. What happens next? When the virus enters the body, it uses those proteins on its surface, the one look like a crown, to enters on our cells. Those proteins look like a key that unlocks the receptors outside of the cell. It's specifically the ACE2 receptors on our lung that coronavirus using to get inside our cells. Once the virus is inside, it then releases RNA. It is a genetic material, and it tricks your cells into making the copies of the virus. So, your cells actually like a factory producing of 1,000 virus without even realizing it. So, in the beginning, when the virus is replicating, you don't actually have any symptoms yet. And this is called the incubation period. It's different for lots of different viruses, but in case of SARS-CoV-2, the incubation period is 4 days. So now, let's take a look about the symptoms of the COVID-19. So, what kind of symptoms are people actually presenting with? So we're lucky that we've got information coming out of China to know what to prepare for and what to expect. So the most common symptoms are fever, sore throat, cough, some shortness of breath. And we look at fever. People who coming into the hospital, only about 43% of them had fever. When they were in hospital, about 88% of them developed a fever. So, what that tells me is that if you don't have a fever, it doesn't guarantee that you don't have coronavirus. Less common symptoms are nausea, vomiting, diarrhea in about 3 until 5% of people. So that's why you need to watch out for fever, cough, shortness of breath. And I know what you're gonna say, but that sounds like a flu, that sounds like a cold. And you're absolutely right, and that's what makes this so tricky. So, if you do get mild symptoms, cough, fever, sore throat, What you should do is actually stay at home, don't panic, and if you are quarantining yourself at home while you're sick, but you live with other people, try to have like a sick room, and in that room, you try to stay there most of the time. You have your own dishes and utensils. Try to use your own bedroom if you have that option, just to prevent the other people in your house, preventing the other people in your house from getting sick. And the most important thing is to really be monitoring your own symptoms and seeing if anything is getting worse. Seeing if you're getting really short of breath, if you're getting chest pain that's not going away, or if you find you're getting really high fevers, you're getting confused or even having blue-tinged lip, all of that will be the sign that things are becoming quick severe and you should be going to the emergency department. Okay, I just want to say this one more time. For most of us, if we get COVID-19, we're going to be okay. Don't panic. Most of us can recover at home. We never need to even see a doctor or go to a hospital and you'll just be fine. We just have to watch out for those severe symptoms. So, who at risk at catching COVID-19? Well, the answer is everyone. No matter what age you are, you can catch COVID-19 or coronavirus. You see, is the people who most severely affected is the elderly and those who have underlying health condition like heart disease, lung disease, and immunosuppression and diabetes. Those people go on to get a worse version of the disease. In China, about 78% of the cases are the people aged 30 until 69. And of those people, about 20% of them have a severe illness. So it definitely that not just the elderly that affected, but also the one who tends to have a higher fatality rates. Although we know who is at risk, we don't actually know who is become critically ill and need life support. So it's really important to us to do our part to stop the spread of virus. For this to work, for us to really save life, we need to all be in this together, and there are two main things that we need to do. Number one is washing your hands really well and frequently. So that means 20 seconds of washing your hands. A long time, by the way. It's about happy birthday song twice. Make sure you get your fingernails. Make sure you get between those fingers and the back of your hands. Number two is social distancing. So there's been a lot talk about this. This is 6 feet between you and anyone else or 2 meters, but it doesn't mean isolating yourself. So make sure that you're reaching out to friends and family. We have this wonderful technology. You are not alone and don't let yourself get isolated. I know there is a huge strain on families. I know that there's a lot of financial demand, and I just want to say thank you, because what everyone is sacrificing is at the community level really helping in saving life, and it's inspirational to hear these stories. Should you be wearing a mask when you go outside? The World Health Organization says that if you are healthy and you have no symptoms, you don't need to be wearing a mask. It's only people who have symptoms, cough, fever, and cold, they should wear a mask. Or a healthcare provider who's looking after someone who has COVID should have a mask on as well. Personally, when I go outside, I'm not wearing a mask, and otherwise I just come home and scrub my hands really well. So treatments. As of now, there are no antivirals that have been proven to treat COVID-19. There are lots of other trials going on around the world, and I'm really hopeful that we are going to come up with some great treatment option in the future. What about vaccine? Scientists are working tirelessly to come up with a new vaccine, and progress has been fast because China early on was able to sequence the genes with the virus, and they shared that with everyone internationally so that we can come up with a vaccine quickly. From what I understand, there's one in China and there's one in the US that are gonna be starting testing. But even with this fast progress, we are still looking at close to a year before they are gonna be able to distribute it to everyone, I mean. Okay, so now we're covered a lot of material. The most important thing at this point is each of us playing our part, washing our hands, keeping social distancing to stop the spread, so we don't overwhelm the healthcare system. I know this is such a difficult time. There's so much uncertainty and things are changing so quickly. So I know in my heart that we can get through this together. Okay, thank you.